Ocular pharmacology, mydriatics. Definition of mydriatics: the drugs which causes dilatation of the pupil. Mydriatics are the drugs which causes dilatation of the pupil. Mydriatics causes dilatation of the pupil. Classification: they are classified. Mydriatics are classified into two types: parasympathetic and sympathetic. Parasympathetic and sympathetic. Parasympathetic mydriatics are atropine, homatropine, tropicamide, cyclopentolate, and hyoscine. On the other hand, sympathetic mydriatics are adrenaline, phenylephrine, and cocaine hydrochloride. Adrenaline, phenylephrine, and cocaine hydrochloride. Now, mode of action. Mode of action of parasympathetic mydriatics. Parasympathetic mydriatics, these drugs bounds with and block the muscarinic receptor of the ciliary muscles of the circular muscles of the iris. These are the circular muscles of the iris. These drugs, that means parasympathetic mydriatics, binds with and block the muscarinic or M receptor of the circular muscle of the iris. Then radial muscles contract. These are the radial muscles. These muscles contracts. Radial muscle contracts due to unopposed sympathetic supply. Consequently, dilatation of the pupil occurs. Then sympathomimetic mydriatics. Parasympathetic mydriatics, then sympathomimetic mydriatics. Sympathomimetic mydriatics. These drugs cause contraction of the radial muscles of the iris. This causes contraction of the radial muscle. These are the radial muscles. Causes contraction of the radial muscles of the iris. Consequently, dilatation of the pupils occurs. These are the normal pupil and this is the dilated pupil. Then indications or uses of mydriatics. Indications or uses of mydriatics. These are used in fundus examination. Okay, we need to dilate the pupil in fundus examination. Then for pre-operative assessment of the cataract, during extracapsular cataract extraction or posterior segment surgery, to test any posterior synechia is present or not, to break posterior synechia along with cycloplasics. Then causes of mydriasis or differential diagnosis of dilated pupils. Dilatation of pupils occurs on effect of topical sympathomimetic drugs. Sympathomimetic drugs already said, adrenaline and phenylephrine. And parasympathetic drugs are atropine, homatropine, the tropicamide, cyclopentolate, and hyoscine. Effect of acute congestive glaucoma and absolute glaucoma. Acute congestive glaucoma and absolute glaucoma. Absolute glaucoma are irreversible type of glaucoma where blindness of the eye occurs. And cycloplasia or cycloplasic. Cycloplasia means paralysis of the ciliary muscles. Cycloplasic drugs are those drugs that cause paralysis of the ciliary muscle. And classification of the cycloplasic: systemic and topical. Systemic and topical. Cycloplegic drugs are two types: systemic and topical. Systemic drugs systemically used atropine, only systemically used atropine are used as systemic cycloplegics that causes pupillary dilatation or mydriasis. Then topical cycloplegics. Topical cycloplegics are two types: parasympathetic and sympathomimetic cycloplegics. Parasympathetic and sympathomimetic cycloplegics. Parasympathetic drugs are already been told: atropine, scopolamine, homatropine, cyclopentolate, and tropicamide. And sympathetic cycloplegics are adrenaline, phenylephrine, and cocaine hydrochloride. Adrenaline, phenylephrine, and cocaine hydrochloride. And differences between mydriasis and cycloplegia. Differences between mydriasis and cycloplegia. In mydriasis, there causes dilatation of pupil. Dilatation of the pupil occurs. And in cycloplegia, causes paralysis of the ciliary muscle. Paralysis of the ciliary muscles. Accommodation. Accommodation means inability to see the near object clearly by increasing the converging power of the lens. By increasing the converging power of the lens. This is accommodation. Accommodation is intact in mydriasis, but accommodation lost in cycloplegia. Ocular mobility normal in mydriasis and restricted in cycloplegia. Restricted in cycloplegia. Then example of mydriasis is phenylephrine, and example of cycloplegia is atropine and homatropine. Atropine eye drop. Atropine is an anticholinergic or parasympathetic drugs. Preparation or formulation. Drop preparation 0.5% in children and 1% in case of adult. Ointment 0.5% and 1%. Doses one drop given 8 hourly, and ointment given at night. Onset of action within 30 to 40 minutes, and duration of action 2 to 3 weeks. That means 14 to 21 days. Mode of action of atropine blocks muscarinic receptor of the sphincter pupillae, and radial muscles of the iris remain unopposed. Consequently, dilatation of pupil occurs. Indications. There are two types of indications: therapeutic indications and diagnostic. Therapeutic indications. Therapeutic indications are iritis and iridocyclitis, synechia, prevention and breakdown of synechia, corneal ulcer, removal of foreign body after all intraocular surgery. Diagnostic uses are retinoscopy and ophthalmoscopy. Retinoscopy is done to see the refractive error, and ophthalmoscopy is done to see the posterior part of the eye, that means retina, optic nerve, etc. Retinoscopy and ophthalmoscopy are not same. Then contraindication. Contraindications of atropine eye drop: high hypermetropia. Number 1, high hypermetropia. Number 2, microphthalmos. Number 3, microcornea. This is microcornea. Cornea size, the size of cornea is less than the normal size. Then shallow anterior chamber, all glaucoma except glaucoma secondary to iridocyclitis. It is also used in iridocyclitis. Adverse effects or toxicity. Adverse effects or toxicity: dry mouth, dry, red and hot skin, raised temperature, tachycardia, excited behavior, and flushing of face. Flushing of face. Anti-glucemic drugs. Anti-glucemic drugs are three types. Drugs that reduce, and types of anti-glucemic drugs according to action. First of all, drugs that reduce aqueous humor production. There are drugs that reduce aqueous humor production. Aqueous humor are produced from the ciliary body. Then it goes to posterior chamber. Through pupil it goes to anterior chamber, then trabecular meshwork, and finally goes to systemic circulation. Drugs that reduce aqueous production. There are two types of drugs. Number 1, beta blocker. Number 2, carbonic anhydrase inhibitor. Beta blockers such as timolol and betoxolol. Carbonic anhydrase inhibitors are acetazolamide, dorzolamide. Drugs reducing vitreous volume. Drugs reducing vitreous volume. This is the vitreous humor. Drugs that reducing the vitreous volume: mannitol 20%, and oral glycerol. Finally, drugs that increase aqueous outflow. The drug that increase aqueous outflow or aqueous exit: myotics and prostaglandin analogs. Myotics such as pilocarpine and prostaglandin analog. Anesthesia used in ocular surgery. Two types of anesthesia: local anesthesia and general anesthesia. Mainly used local anesthesia. Local anesthesia are two types. First of all, surface anesthesia or topical anesthesia. Number 2, infiltration or regional anesthesia. Infiltration or region anesthesia. This is number 2. Region anesthesia are of 5 types: facial block, retrobulbar block, peribulbar block. This is the example of peribulbar block. First injection, then second injection. Subtenon block and regional block. Finally, general anesthesia. LASIK. The full form of LASIK is laser assisted stromal in situ keratomiliosis. By this procedure, superficial corneal flap This is superficial corneal flap is lifted first, then central corneal stroma, then central corneal stromal bed is ablated by excimer laser. Uses depending on corneal thickness, it can correct hypermetropia up to 4 diopter, astigmatism up to 5 diopter, and myopia up to 12 diopter. Complications are of two types: operative and post-operative. Operative complications operative complications are buttonholes, then thin flap amputation, incomplete or irregular flaps, rarely corneal perforation. Post-operative complications are dry eye, wrinkling, distortion or dislocation of the flap, subepithelial haze that may cause glare at night, epithelial defects, and diffuse lamellar keratitis. Finally, bacterial keratitis, though it occurs rarely. Criteria for suitable case of LASIK patient or precondition of performing LASIK. Criteria for LASIK: aged 21 years or more, stable refractive error, unsatisfactory result with non-surgical correction, absence of corneal thinning disorder. 4 criteria: patient age 21 years or more, stable refractive error, unsatisfactory result with non-surgical correction, absence of corneal thinning